Students, I hope you all are fine. Welcome to Political Science class, Bridge Course Session 19. Okay, in this session, I am explaining about role of the government in health. In this chapter, we are learning about some concepts here to develop an appreciation for good health, to understand the role of the government in providing health care to all, to critically evaluate the disparity prevailing between healthcare facilities provided by public sector and private sector, to be aware of the gender discrimination that exists in the access to healthcare facilities in India. See in this picture, look at the picture here. Would people living in such conditions be more prone to illness and diseases? Okay, see. So first I talk about understanding health. What is health? See, first question is arising here. What is health? Health is our ability to remain free from illness and injuries by being physically fit. However, health is just not a physical fitness but also mental well-being. When we are free from anxiety, fear, and are physically fit, then only we are termed as a healthy person. See here, WHO, World Health Organization, states that good health is one of the fundamental rights of every human being. It should be made attainable to every human being without any distinction. So there are various aspects of health which form part of our daily life. In order to active and to be without mental strain, so we requires good food, okay, nutrition and clean drinking water and pollution free environment. So all these are integral to ensuring good health. So next I talk about, next concept is here, healthcare resources. Healthcare resources in India, it is providing care during an illness, diagnosing and treating the illness, treating the patients here. In Article 21 of the Indian Constitution imposes obligations on the state to safeguard the life of every person. Thus, public health is a concern of both the central and state government and is executed through the 5 years plan. The plan stress that the central government should coordinate the implementations of the healthcare measures with the states and should jointly share the expenditure with the concerned states. Health services, see here, the healthcare means health services, some facilities are there here, okay. In hospitals they are giving some good services for the people. There are two types of healthcare services in India. So see here, one is there here public and second is there here private, okay. So first I talk about public health services. Healthcare programs are implemented by the central government in coordination with the state governments. The central government also sponsors most of the government hospitals in big cities. And to ensure that healthcare is accessible to all, the government has adopted the universal healthcare system. This system ensures that policies are in place to provide a specified package of benefits to all members of the society at bare or minimal cost of improvement, means that is the access to the health services, and improve means improved health outcomes. And the idea of universal healthcare is determined by three critical dimensions, means who is covered, so what services are covered, and how much of the cost is covered here. To ensure these healthcare centers have been set up in every part of the country. In rural India, these centers also known as PHC, means primary health center. So all these centers should have a doctor, a pharmacist, and a midwife to cater the basic amenities. About the primary healthcare centers are district hospitals. These hospitals cover many villages in the district and supervise the working of the primary health centers. Large towns and cities have better equipped hospitals depending upon the population, and it is prevent to polio disease, measles, and diphtheria. And next you see here private health services. Private health services are profit oriented. Okay, private healthcare services are set up by individuals and corporates, and the facilities offered by these hospitals and healthcare centers are better than the public hospitals. As aim of these hospitals is to generate business and make profit. So these hospitals are normally set up the urban areas. Private health sector offers 80% of the health services in India. The government alone would not be able to cater to the huge demand of the services required. Therefore, the government allots land and subsidized rates to private entities to set up the hospitals. So this is with the understanding that the hospital will cater to the needs of a certain percentage of underprivileged population by providing free healthcare services. And see here, students, public health is major concern across the globe that spread of global epidemics such as Zika virus, swine flu, Ebola virus, dengue fever, and yellow fever affects millions of people. And also nowadays also we are seeing that big disease is there, that corona disease also. Okay, so we are seeing that it is a concern that only for the national governments but also for the international community. It is the World Health Organization, WHO, plays a significant role in the monitoring and mitigation of such outbreaks. It is a specialized agency of UNO, and its headquarters are based at Geneva in Switzerland. Okay, so it is about public and private health services. So next you see here, the government needs to advocate the measures to provide quality public health services to all the rural and urban areas also. And we are seeing here some measures taken by the government to ensure equality in the healthcare. So today we see both government run and privately owned by healthcare services all around us. Private services are mainly concentrated in urban areas in rural India. Even today, the healthcare services are not adequate. A large part of our population cannot afford the responsibly good healthcare services offered by the private hospitals and clinics. So the government has taken up the certain remedial measures to ensure that healthcare facilities are made accessible to all. One such is Pulse Polio Campaign, which the government started in 1995 to 1996 to eradicate polio. So this project was implemented on a large scale with the government roping in the services of various international institutions, state governments and non-governmental organizations. The project was a huge success. The concentrated efforts of the government and health works paid off when on March 27, 2014, the World Health Organization declared India a polio free country. So, Chennai is termed as India's health capital. This we are seeing here. The government is also working with the private sectors on a public private partnership in areas of family welfare and AIDS related diseases. Okay, students, I hope today's class, the role of government, okay, you have understood. You make the points and send it my WhatsApp number. And next session I am continuing in next class. Thank you.